Hey guys, this is Michelle from Virtual Hand Care, and in this video, I'm going to share with you 3 pain relieving tips you can try before you start your hand, finger, or wrist exercises. You might notice doing your rehab exercises or just really even just using your hand is very, very uncomfortable. Maybe it's so uncomfortable that you're having a hard time getting your motion going because the pain is stopping you. Rather than going into just trying to move, I recommend to try this sensory approach first with these 3 tips. If you've ever hurt yourself, which that's probably why you're here, you rub your hand, right? Or you rub that area that's sore, and it seems to take away the pain, right? Well, by touching that area, you are stimulating different types of nerve endings and receptors that send signals to the brain. We have mechanoreceptors, somatoreceptors, proprioceptors, pain receptors, thermal receptors. All of these receptors is what helps us feel different types of sensations. And so then by rubbing that area, our brain is then diverted from that pain sensation that it felt. And so then your brain is thinking, oh wait, now I feel this rubbing sensation. And so then it's a new sensation, and therefore it can take away some of that pain. And so that's what we're going to do with these 3 pain relieving tips, is we're going to try to divert the brain from feeling the pain with a couple of different types of sensory tricks. Pain relieving tip number 1 before you start your hand exercises is thermal touch. And what I mean by that is using either heat or using cold to stimulate those thermal receptors to try to reduce the pain. Now, you can do this a couple of different ways. You can apply a hot pack, and I usually recommend moist heat. You can apply moist heat to your fingers, to your wrist, to your hand, to the area that is causing a lot of soreness before you start the exercises. You can do moist heat for 10 or 15 minutes, and you can do that a couple of times a day. If heat seems to not work for you, then you would want to do an ice pack to stimulate those thermal receptors, and then do your exercises after the ice. Now, one tip that I find a little more effective than that is to actually apply the heat or the cold at the same time as your movement. You can do this in the shower when you're getting some moist heat. You can try a couple of those finger exercises, a couple of those wrist exercises at the same time to reduce that pain. Or you can fill up a bucket with warm water, maybe fill up your sink with warm water and do some of your exercises within the warm water. You could also do this with cold water. I've even recommended for people to do something that's called a contrast bath. And that is where you do a few minutes in warm water and then do a few minutes in cold water. And you alternate back and forth, and you're moving your hand, you're moving your fingers at the same time. That can be helpful for decreasing the swelling, but also help decrease that pain. Just be careful that you don't do too intense heat or cold, because our brain can interpret that as painful, because temperature sensations are conducted along the same pathway that carry pain sensations. And that is why touching a hot stove or being out in the frigid cold can cause pain. Okay, pain relieving tip number 2 is sensitization. And that can be done through vibration, through light touch, through deep pressure. It can also be done through tapping. So for example, if you have an area maybe on your finger or on your hand that is pretty sensitive, you can take a towel and you can rub that area before you start to move. And you'll want to do this for a couple of minutes. And you can do this with different types of textures. You can use a soft cloth, you could use something kind of silky, you can use a rough towel. Play around with different types of textures that work for you. Now, you might want to start just with a very light type of touch, and then go through a few of your exercises to see if you notice a difference. If that doesn't seem to make a difference, you might need a deeper type of pressure. Now, another way to do sensitization is tapping. And I usually recommend, if you're going to do tapping, that you do it a little bit farther away from the area that it's painful. So say you do some finger exercises and those are kind of painful. What you want to do is provide a tapping sensation to an area that's a little bit farther away from your fingers, because again, what you're doing is you're diverting those signals so that the brain now feels the tapping sensation rather than the pain you might feel with your exercises. Another way is to just provide some deep pressure. You can provide deep pressure to the stiff finger, maybe to the stiff hand, as long as that feels comfortable for you. And then also going just farther into the wrist and then farther down into the arm. And I recommend to do sensitization types of techniques for at least 5 to 10 minutes and doing those a couple of times a day. Another sensitization technique is to use vibration or massagers that will vibrate. That way, again, you're diverting that sensation away from your finger, but then you can do the exercises with the vibration. You can also try it in other areas along your arm as well. And finally, tip number 3 is skin gliding. So we are going to move the biggest organ in our body. Now, if you've seen any of my other videos, you know the importance of wrinkles and movement of our skin, because if we don't have good movement of our skin, if we're not seeing many wrinkles, that usually means that there's a lot of swelling in our fingers, then therefore you get a lot of stiffness and therefore you get a lot of pain, and it's kind of this cycle, and it can make it difficult to do your exercises, which are really important. Now, to do the skin gliding technique before you do the exercises, what you want to do is you're going to be using your other hand to basically help move that skin and try to give yourself some wrinkles to that joint that you're trying to move. So if it's your PIP joint that's very stiff, what you would want to do is glide and move the skin up towards the PIP joint, because we need those wrinkles in order for that joint to move. With each of you, this might look a little differently. If you are having some soreness in the wrist, then you might need to kind of come down here more into the forearm and push some of that skin up towards the wrist. And then you would want to do some of your exercises. So you can do this up towards the joint. You can do this down away from the joint. You can do it across and over. What you're looking to do is find that skin glide that feels right for you and that helps you get a little bit more movement. Now, if that skin traction feels really good and you like the way that feels, then you can apply K-tape or kinesio tape or muscle aid tape to your skin to help keep that skin traction for a couple of days. You can see a big improvement by applying some kinesio tape to help with that skin gliding. Now, just to recap those 3 pain relieving tips before you start exercises, tip number 1 is to stimulate those thermal receptors. So you can do that by applying some moist heat, applying some cold. You can do both. You can do the contrast bath and do heat and do cold and stimulate those thermal receptors before you start doing your exercises. Or you can also do a couple of your exercises at the same time of getting that heat or that cold. And remember, tip number 2 was sensitization. So that's providing some vibration or some tapping or some rubbing with different types of textures over that area. Or you can also do it a little bit farther away from the body part that you are trying to move. And tip number 3 is skin gliding. And you can do that by moving and gliding the tissue, gliding the skin around, giving those joints, giving the finger joints, giving the wrist joint, whatever body part you're working on, giving that skin some nice mobility, some nice glide, and giving yourself some wrinkles so you can get those joints moving again. And remember, if you like the way that feels, then applying some tape to the skin can help keep that traction for a couple of days to help you get faster results. Now, I hope you found this video helpful. Let me know in the comments below if any of these 3 pain relieving tips helped you. Let me know which ones that you have tried. If you found this video helpful, do please give it a like and don't forget to hit that subscribe button below. And finally, don't forget to check out these videos here that YouTube is suggesting for you. Thanks for watching.